$20 government health care takeover is eroding. Republican Senator and author of Saving Freedom, Jim DeMint of South Carolina, joining us now. So, Senator, last night when the president spoke, he said, quote, "I am frustrated by the misinformation that is being thrown out there to the American people from the Republicans." Your response to that?
Well, the president was dancing around the facts last night. It's clear from outside experts, really independent evaluations of his plan, that 80 million people will lose their private health insurance. This will cost the country, put us into more debt, and cost us more jobs. I mean, that's not a Republican view. That's the view of the outside. And my goal in all of this is just to protect the rights of moms and dads to make their own health care decisions for themselves and their families, to have a choice between health care plans, and to lower the cost of health insurance for all Americans. We don't need a government takeover, and the kind of taxes they're talking about on businesses to make this work is going to make America a lot less competitive and send more jobs overseas.
Yeah, but Senator, it seems like at this point we all have pretty well come to our positions on how we feel about this, but it seems like this is kind of a congressional strategy now where Nancy Pelosi is working votes, giving things, taking things away. Right. It seems like it's more in your court than it is in our court anymore. So what do you think is going to happen? Is this going to get pushed into the fall?
Well, I would disagree with you. The whole outcome of this depends on the American people, what they do with this over the August break. I don't think we're going to pass anything before we go home for that August break. The American people have to let their voices be heard, that they don't want the government deciding, as the president talked about last night, whether we're going to get a red pill or a blue pill. That's not the government's decision to make. We need to keep the healthcare system working. The part that's working, we need to expand. And for those who don't have health insurance at work, there are a lot of good ways that we can make it more affordable and available. I've introduced those plans. The president has voted against them. He has not supported health care reform when he was in the Senate. All he seems to be after right now is more government control of health care.
Like we had with Medicare and Medicaid, which some argue has not worked out so well. Let me ask you about the Blue Dogs, Senator. You may have some unlikely allies, or maybe likely, in the Blue Dog Democrats, the fiscal conservatives. They're a little nervous about the cost going back to their constituents with the cost of health care reform. Are you having conversations with some of the Blue Dogs right now?
Well, I've talked to a few of them. In the past, their bark has been much louder than their bite, but they are hearing from their constituents, and that's why it's important that Americans speak up to their representatives, whether they're Democrat or Republican. Let them know that we want to keep the health insurance plans that we've got. We want to do things to help the poor, help others have insurance when they don't have it, but we don't want every American on a Medicaid plan that doesn't pay doctors enough to see us. It doesn't make sense to take what's not working and expand it to every American.
You know, Senator, you called you made a crack about Waterloo. You made a statement about this being the president's Waterloo. Last night, the president also citing another Republican basically lobbyist, Bill Kristol. Do you think that these kinds of what he's calling political attacks will redound negatively on the Republican effort to reform health care?
We are attacking the policy. This is not personal. The president's trying to make it personal to distract attention from the policies. His policies have not met up to his promises yet. We see that on the stimulus plan. He is trying to distract and deflect attention from the real substance of this bill, which will take away our freedom to make our own decisions about health care. More and more I hear Americans saying, "Keep your hands off of my health care." And that's what the government should do. There are a lot of things we can do to make it less expensive, to make it work better, but this approach of a government takeover is not going to fly well with the American people.
Well, if you look at the polling numbers of the president, it already is starting to kind of shift that way. Senator Jim DeMint, we're going to have to leave it there. It's always great to talk to you, though, Senator. Thank you, sir, for appearing on Fox Business.
Thanks a lot.
You know, you talk about the cost of health.